Gusto niyo nang matulog, ako hindi. So thank you very much for coming, and I think again, yesterday and even in the past we have already discussed that it's not only the health sector, but the social determinants for health plays a major role in achieving improvement in health, whether it's in a decentralized or centralized system. The same unless we prioritize health. In fact, we really have to invest on primary health care. And if we invest on primary health care, there will be a very, very big opportunity for us to move from third world at least to the second world. If you go to, this will be the next assignment, but I will explain later. Different country have different healthcare system. But until we finish up to a standard declaration on universal healthcare, you're going to, you have groups, diba? How many groups do you have? 6? 7?
12 po.
12? 12 groups, ang dami. So 10 in each group. I'll just answer Mayor. Okay. So when we say principles, whether what country you are in, you have to follow these basic principles. Number 1 is universal access to basic health services must be ensured. How we are going to ensure that? So meaning the 6 building blocks must be in place. From the service delivery to the leadership and governance, ano pa yon? Ano pa yung 4? Technology, human resource for health, no? And the health and nutrition of vulnerable groups must be prioritized. Actually, even in COVID-19, this is how we should target it. We will no longer target, although the number of the age group of people affected with COVID-19 in the city of Tacloban is between 21 to 30 years old, up to even 50. So if we have 800 plus, 250, 234 are from ages 21 to 50. So meaning they are the one who is engaged in employment. So syempre, kung nandun ka sa labas, ikaw yung mas prone to the virus. And out of the 893, yung morbidity week 44, almost 200 are healthcare workers. Okay. Number 3 is the epidemiological shift from infection to degenerative diseases must be managed. This number 3 is very important. It is no longer epidemiological shift, but it's now triple threat, no? The infectious diseases, non-infectious or communicable, non-communicable, and the third one cannot be labeled as non-communicable as road traffic injury, substance abuse use, and mental health. Okay, mental and neurological health. No? And then number 4, the performance of the health sector must be enhanced. So with those principles, what are the strategies in order to achieve health goals? We need to increase investment for primary health care. So kailangan, pagpunta nyo sa isang health center, you feel na nandun kayo sa St. Luke's. Okay? So ngayon, with the universal health care, they are now certifying primary care workers. Even though you are specialist, you can register as primary care worker. And then number 2 is development of national standards and objectives for health. These standards and objectives for health, for example, like right now, all Filipinos must be PhilHealth enrolled. No? But no problem with the enrollment. The problem is on the utilization. I think with 121 first-year students, siguro ilang percent lang sa inyo pag magkasakit pupunta ng EVRMC. Because of the perception, all of you will rather go to a private hospital such as St. Paul's, ACE, or RTR. And then assurance of the healthcare. How can we have that assurance of the healthcare? For example, libre nga yung konsulta, wala, bibili ka naman lahat ng medicine, 'di ba? And it happens to all government agency. And then 4 is support to local health system development. Actually, kung if we can empower every local chief executive to look into how health can affect, no, the productivity of a person, malaki ang posibilidad that even if you are in a GIDA says GIDA is geographically isolated and disadvantaged area. And number 5, support to frontline health workers. I will stop share for a workers ang pwedeng ma-demotivated, no? Nakukulangan sila sa motivation, pero siguro umpisa lang 'yan. Everything there is a change, may mga ano talaga, merong resistance, no? People will always resist change. Okay? So, before there is an HSRA or the Health Sector Reform Agenda, thank you, Romeo and Katrina. The HSRA is directed mainly at expanding effective coverage of national and local health programs. So meaning, walang problema mag-expand. Ang tanong doon is effective ba? So is it really effective? Okay? And then increasing access especially by the poor. I don't have parang resistance with this, no? Increasing access especially by the poor. But do you believe some people become poor out of their own stupidity? Yes or no?
Yes, Doc.
O yung
Yes po,
iba?
Doc.
Yes,
Di
Doc.
ba?
Yes.
Yes, Doc po, Doc.
Yes,
Please
Yes,
answer.
Doc.
Alam mo, we give alms. We just give alms. Pangtapa lang. We give band-aid solution. But we need a lasting solution. And then letter C is reduce the financial burden of individual families through the universal coverage of the National Health Insurance Program. Pagdating natin sa universal healthcare, we will expound more of that. Okay? And then after HSRA, nagkaroon ng Formula 1 for health. Ngayon, F4, di ba? May F4 dati. Kaya nagkaroon ng ganito. They said that it's designed to implement critical health intervention as a single package backed up by effective management, infrastructure, and financing arrangement. It includes the public and private sectors, national agencies, LGUs, and civil society involved in the implementation framework of health reforms. Actually, it's 2001. I'm already with what you call this, with RTR, no? Ang hirap, hindi pa rin talaga natin, sinasabi lang natin na, okay, we do network and ano, pero every institution has their own deliverables. Kaya lahat gustong sikat, no? Kaya kahit na sabihin mong mag-involve ang lahat, hindi pa rin talaga siya natutuhay, no? The objectives, of course, is to have better health outcome. Okay? So, since you are in public health, anong difference ng outcome sa output? No? Output, if you have inputs, you have output. For example, you have this number of people working for the immunization, nurses or midwife. So your output would be number of children immunized. The outcome would be fully immunized children. How many children have completed their immunization? 95%. How many children between 0 to 23 have 95% accomplishment in terms of fully immunized. So that is an outcome. Your outcome will address your objective while impact address your goal. For example, what is your goal? Your goal is to be a doctor. Okay? So, what impact you will make is that hindi lang basta magsa-study ka, pero you go beyond. For example, kailangan magbabasa ka, hindi ka lang mag-aaral pag malapit na yung exam. After every lecture, nag-aaral ka na. That's an impact. An outcome naman is wala kang bagsak wala kang bagsak in every subject, no? So you were able to pass all the subjects. That's an outcome because that is your objective, to pass anatomy, pass PCM, pass histology. Pero yung output mo doon is you were able to attend the classes, you were able to pass the quizzes, but eventually your outcome is to pass the subject. And your goal is to be a doctor. Okay. So, dapat ganun na tayo mag-isip. We always look on the outcome, and then eventually, even at your end, no, you will have an impact in the community. Next is more responsive health system. Parang kinikita-kita natin na when you entered EVRMC, feeling mo nag-enter ka na rin sa St. Luke's Medical Center sa BGC. Wow! Possible ba yon?
Di lang mapatapod.
And of course, more equitable healthcare financing. So, I already explained to you yung equity area, di ba? Equity does not mean everybody have the equal opportunities, but we will give more opportunities for those who needed it. Okay? And then, of course, yung Alma Ata, tandaan nyo to, September 6 to 12, 1978, Alma Ata is a place, no, in Russia. Hindi siya word, but it's a place in Russia with 134 members of the World Health Organization. And there was a declaration during that time, September 12 before the ending, to strongly endorse the Health for All 2000. 2020 na tayo, dapat Vision 2020, hindi rin na-fulfill. Ano kaya sa 2040, 2030? So, meron ding kaya if after we discuss this, we will be discussing the Astana. Sana naman 2020, marami na. Vision 2020. The goal and stated that primary healthcare is the key towards the attainment of that goal. Sa universal healthcare, ganun din, primary healthcare din. Anong nangyayari? Walang nangyayari. Kasi nga, parang hindi talaga natin napipicture pa because of we will be addressing, for example, February, supposed to be mag-aano na yung we call this, universal healthcare. Bigla namang nagka-COVID. So parang na-set aside na naman siya. So primary healthcare has 3 dimensions. One, as a philosophy. Second, as a minimum set of health activities. And number 3, as the most peripheral structure of the health system. So when we say it's a philosophy, it aims to reduce the inequality in health status by giving priority to the underserved population, utilizing appropriate and affordable technology, actively promoting intersectoral action for health, and developing the community as an important base for health activities and decision-making. Second is primary healthcare as a minimum set of health activities that must be provided or enjoyed by the population. One is environmental sanitation, control of communicable diseases, immunization, health education, maternal child health and nutrition, family planning, provision of medical care and emergency treatment, treatment of locally endemic diseases, and provision of essential drugs. Okay, among these 9 minimum set of health activities, ano yung pinaka-challenging? What do you think ang pinaka-challenging? So far, sa nakikita niyo. Come again? Who is that?
Health education, Doc.
Why? Why it's very challenging?
I think, Doc, because it is easy to educate people, pero it's difficult for them to understand and, what do you call it, uh, put it into action.
Compliance, da? Bakit ang
Yes.
hirap-hirap sa taong mag-comply? 'Di ba? Ito
Learned
lang
habits,
wearing
Doc.
of mask and ano, alam mo yung mga healthcare workers na nahahawa, most of them, in a very short period of time, inaalis nila yung kanilang mga mask. Why do you think it's very hard for people to comply? And thank you sa mga naka-uniform ha. Thank you. I salute you. Kasi dapat talaga naka-uniform kapag nasa klase. Kasi nasa klase tayo, virtual nga lang. Sige, Dr. Balicano. Bakit health education ang laking factor talaga siya? Pero yung compliance, ang hirap, di ba? Even in the giving of medicine, both in the individual level. Ilan kaya sa iraresetahan nyo ang tatapusin yung kanilang medicine? Why do you think? What are some of the
Not
reasons
all, Doc.
on the poor compliance of these people? Not only on medicine, not only on management, but also on these standards. Kahit sino pwedeng sumagot. Ito, I can see, is this? Yes, please, sagot na kayo. Just sa answer. Hindi ko makita.
For me, Doc, it's because of the lack of information gyapon and the knowledge during the prescription of a particular medicine. Some of the doctors has lapses also that they lack to educate the patients what would be the cons if they do not continue in taking the medicines, because some of the perceptions of the perceptions and attitude of our patients, by the time that they no longer feel that certain discomfort that they feel that opted them to go to the hospital, they no longer take that particular drug. That's why we have an increasing percentage of antibiotic, what do you call this?
Resistance.
Resistance.
Antimicrobial resistance.
Yes,
AMR.
AMR. So that's why yun, they do not they have poor compliance with the medication. Let's say for example, for the hypertensive patients, by the time that they no longer feel the nape pain, the headache, the dizziness, they no longer take the medication because for them they're already cured. But for us who knows what really is happening, we just know that it is just controlled. They are not cured. Perhaps we lack the
Thank you.
information dissemination to them that that is really what will happen. That's why you no longer feel the discomfort you felt before. It's because of the medication. But that doesn't mean that you no longer have to take your
Kaya nga,
medication.
you are just first year, right? You are starting to be a doctor. Dapat tinitake note nyo ito, no? When I had the opportunity to look into the health system of Switzerland, Korea, US, Cambodia, iba-iba, no? Both and ano, nakikita ko ang laki-laki talagang factor, ang laking factor ng education. Thank you, Dr. De Vera, for answering. Patients are impatient, no? Patients are impatient, no? At complying or adhering to medication po, like when they better, they won't take the medicine. Yeah, that's true. Another thing is they don't see the value, eh. No? If they, the health, it has to, the answer for this is the health-seeking behavior. Kaya up to now, hindi pa kayo pinanganak, nagpo-problema kita sa tuberculosis. 'Di ba? Ang tuberculosis dati, dalinggam ngayon na ang hirap kasi because of the MDR-TB, multi-drug resistant. Kasi nga naman, papainom mo, halimbawa, rifampicin has to be taken on an empty stomach. Pero siyempre, sanay tayo na kailangan lahat ng medisina, iinumin mo ng may pagkain. Ang amoxicillin, no, when you reach pharmacology, amoxicillin is not stable in a gastric pH. Kaya dapat amoxicillin should be taking 30 minutes before meals, unlike clindamycin or erythromycin. So these things, kailangan na-explain ito sa pasyente. Kaya nangyayari, yung iba, nakaano na ba kayo ng mga ibang healthcare professionals na nagsha-shotgun therapy? Kasi nga, kaya lumabas ito ng mga once a day dosing, lumabas ito ng mga 3 days lang na inuman because of compliance. And very, very important because you're starting to be a doctor, dapat na take note nyo na ito because you will be the best doctor. Tama? Okay. Other than health education, thank you ha. Meron pang gustong sumagot? What are some of those challenges? Saan yung pinaka-challenging other than health education? But I believe talaga ang laking factor ng health education because that is where empowerment will start. And of course, empowerment will also be effective if you are a good model or good example. Ganda ng bahay nila, Dr. Amago, oh. Dr. Amago, would you like to say something? Ganda ng bahay nyo, parang meron ganda-gandang bahay dyan.
Background lang po, Doc. Doc, for me po,
Yes, Dr.
environmental... Ay, sino po?
Yes, why did you brought it up? Environmental sanitation, talagang what is in the environmental sanitation that, ang laki kasing focus na environmental sanitation, Dr. Aba. Kasama pati dyan yung occupational health. Sige, say something.
Amago po, Doc.
Ay, okay, sorry. Dr.
Environmental
Amago.
sanitation po, Doc. Same po, Doc, nung sinabi ni Doc Makamay sa slaughter area, sa squatters. Hindi po lahat, 'di ba? Like yung bahay is dikit-dikit, tapos sometimes yung ibang bahay is harani sa malapit sa may beach, tapos wala silang sariling CR, minsan yung CR is for
Anong
the
tawag
whole
doon?
barangay.
Anong tawag sa CR na yon?
For common.
Kaibo.
Parang ganun.
Ha? Ang tawag doon is, anong tawag doon? Antipolo type, di ba? Do you still know the antipolo type of toilet?
No, Doc.
Yes, Doc.
Mental sanitation, health education, sino pa? Ano pa among the 9 ang pinakamahirap, ang challenging sa palagay nyo in a public health context?
Food and nutrition.
Teka, sino yun? Hindi ko na maalala, hindi ko makita. From doon pa lang sa tiyan, sa pregnant pa lang, doon pa lang sa tiyan yung baby, hanggang sa dying, di ba? So, iba-iba ang ng nutrition. Every phase of our life may nutrition. Okay? So much about that. Yung local endemic diseases, naman yan madali talaga. Pero challenging din talaga yung nutrition and of course, immunization and control of communicable diseases. Number 3, primary healthcare as part of the structure of the healthcare delivery system. Ito na yung i-implement sa universal healthcare, wherein the primary healthcare physician is the first point of contact between the formal healthcare delivery system and the population. So I was in Cuba. Hindi ka pwedeng pumunta sa diretso sa hospital pag hindi ka pumupunta sa primary healthcare physician mo. Maganda ang healthcare system ng Cuba. Kaya lang, patay ka pag hindi ka sumunod. Kasi,
Also in Canada, Doc.
Ang problema, who answered Canada? Who answered that?
Ako, Doc.
Hindi ko kasi nakikita. Sino yun? Sino? Dr. Timbal?
Yes, Doc.
Okay. Ang problema ngayon sa Canada, the problem with Canada is, stop share ko muna. Pinas kasi highly politicized. Number 2, community participation, intersectoral coordination, use of appropriate technology, development and improvement of health systems, health human resource management, and research. Okay? So, the conceptual framework of primary healthcare is, it is an essential healthcare based on It should be practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. So putting health in the hands of the people. Okay? The rationale for the development of primary healthcare is, of course, the magnitude of health problems. Kasi we are already in a very sick system. Masyado tayong always clinical. 70% of diseases are still preventable. Second, this is one that was given by Group B, Group A, inadequate and unequal distribution of health resources. Okay? Nasaan ba yung mga facilities? It's in the urban areas, no? But the need is in the rural. Of course, number 3, increasing cost of medical care. And then number 4, sorry for the spelling, isolation of healthcare activities from other development. So the approach is not holistic. The approach must be holistic. Okay? So the objectives of primary health care is to develop and maximize people's potential and self-reliance of the community for the improvement of their own health. And then maximize the contribution of other sectors to health and to maximize the extension of effective healthcare services to the periphery. Okay. Primary healthcare is an approach of organizing the community through involvement and participation by the use of community resources, indigenous technologies, and linkages in attaining self-reliance and development. It is also a community-based approach to make basic needs accessible and effective to the people through partnership among GOs, NGOs, and community to achieve self-reliance. Okay. Okay. End of the slide.